Welcome to our first edition of Politics Done Right outside of Netroots, or rather in the Netroots Nation conference here in Pittsburgh, Pennsylvania. And as our first guest today, we have Vic
Uzumeri.
Vic Uzumeri. I noticed I paused because I wanted to make sure to get Uzumeri correctly. Vic, welcome to Politics Done Right.
Thank you, Edberto.
Hey, Vic, we're here trying to unite folks here in the progressive domain and learn about different policies, etc. And one of the things that I've been very interested in is healthcare. Mm-hmm. Now, you are, I call you an expert because you've lived in both systems. You've lived in the American healthcare system and you've lived the Canadian healthcare system. First of all, just an absolute term, which is the better system?
Like every business system, and
right.
I'd characterize these as business systems. I mean, we tend to put magic in there. It's magical healthcare, medicine, Ouija board, and all kinds of stuff. They really are trying to systematically deliver healthcare services to the population. So, in U.S. has one system. Mm-hmm. Canada has another system. There are probably 30 other systems.
The NHS in Great Britain.
Well, the OECD countries, there's 32 countries and 32 different flavors of the system.
Right.
So it's a system. So my background is I taught business operations management, supply chain for a long time, decades. And business systems you never take a business system against another business system and say one is better. You can't. Parts of one are much better than another, and it'll flip the other way. Now, some cases, a lot more parts may be good in one system than are good in another, in which case you form a strong appreciation for the system you think has more good parts.
No, I want to.
And Canada is the one I would say has more, on balance, has more good, well thought out pieces of the puzzle than the United States.
You're a very diplomatic person, is what I will say, because I look both of us are engineers, but as a more, I guess, absolute engineer, I would look and I look at outcomes, and if you look at the outcomes from one system over the other in the aggregate, just about every single system in the OECD comes out
outperforms the United States.
The United States.
Yes.
And I think in my opinion, that's the answer that we look for.
I agree. I mean, if you ask me which would I personally prefer to live with, the answer would be the Canadian system.
Now, you told me a story that kind of boggled my mind. And first of all, we're going to sort of touch on your wife's story, just as it relates to healthcare. But you mentioned something that, to me, when I heard it, I just didn't think about it. You said when you go to a doctor or you seek healthcare in Canada, money never comes up as a topic.
That's correct. The closest, let's see if I can fish it out. The closest it comes is this card. I mean, this might as well, for all intents and purposes, might as well be a Visa or MasterCard.
Right.
I mean, it does exactly the same thing.
So whenever you need help,
you go into a bar, you talk to the bartender, you get your drink, you have your meal, you chat with your friends, you chat with the bartender, they give you service, do all that stuff. The only money you talk to a bartender is when they bring you the bill and you hand them your Visa card.
Right.
Okay, think that experience. And that's the Canadian experience.
So they give you health care and you provide that as the...
You up front. You walk in, and they need to know who you are. That's your ID card.
That's your ID.
So, and at least where I am, downtown Toronto, all of my records are electronic.
Right.
So when my family practitioner sends me for a test, I go to get the test, I show my card. Well, that card allows them to look up my medical records before the test.
Right.
I mean, all that stuff is organized. It's all tied around. And the key is that it's a single point of truth about who I am and where the money's coming from.
Exactly.
And there's a big concept in business about when you build business systems is establishing a single point of truth. That is one place you can always go reliably to and get the facts. And everybody can do it, so everybody can be on the same page.
Unlike our system where one particular doctor, any patient comes in, he has to have a staff to tell him exactly what insurance company are you with and call them up, see what's covered. That's
right.
That
to me is the fundamental flaw and inefficiency in the U.S. system. U.S. system spends 25 to 35% of its healthcare dollar
on administration,
trying to figure out who to stick the bill to.
Right.
I mean, it's not about paying the bill. It's not about delivering a service. There's nothing in there other than everybody scurrying around like rats,
right,
in a maze, trying to figure out who's going to be the unlucky soul that gets stuck with a bill. That's the whole. That's almost quarter to a third of the total healthcare expenditure in the United States. Canada does not have that at all.
Right.
All right. So right there is any medical service you want to provide in Canada. You know, there's minor stuff around the edges, but in theory, it's going to be 25 to 30% cheaper.
Right.
Just because that cost is not part of the equation at all.
That is shame. So tell us a little bit about your recent experience that probably would have bankrupted somebody here in the United States, and you had it in Canada.
Well, we just moved. My wife and I just moved from Atlanta. I mean, my background is I spent 20 years teaching at Auburn University. Mm-hmm. Then I took early retirement and lived for the past decade in Atlanta, downtown Atlanta. And then last August, we sold our condo and moved to Toronto. And both my wife and I are Canadian citizens, natives. We were born there. Mm-hmm. So we were able to move back.
Were you American citizens too? Or
yes,
resident? Yeah.
we're dual because we over 35 years in the United States, I'd become naturalized.
Right.
But you don't throw away, don't change where you're born. So I'm still a Canadian citizen. Right. So was able to move back pretty seamlessly. And to get health care, to get that little card, the only really bureaucratic thing I had to do is we had to have a permanent place to live because it's based on where you're resident.
Residence, right. Yeah, each province have
each one has it, and plus all the paperwork has to go somewhere. They have to have a place to mail you and so on. So it wasn't even when we moved into an apartment. It's when I had the signed lease from the apartment.
Right.
I was able to go down to Service Ontario, the government office with one-stop shopping, show them the signed lease, and they handed me, the equivalent of a temporary driver's license. They handed me a sheet of paper, which was my temporary health card, had the code that mattered.
Right.
Card didn't matter, the code did. And 2 weeks later, the plastic card showed up in my mailbox. That's it.
And now you are a covered citizen.
I was covered from the moment I got that piece of paper with my code number on it.
Right.
The temp.
And then you can go get health care.
I can walk into any, they have a system there. Basically, it's all run through, now in the US, my wife and I were first in downtown Atlanta. We were in the Emory healthcare system. Mm-hmm. I had US pensions and have very good, Medicare, Part A, B, C, D, and supplemental from, the last one was Humana. Mm-hmm. I mean, we were well covered in the States, and I was in the Emory system and then in the Piedmont system in downtown Atlanta. Mm-hmm. And within those systems, we could sort of get anything we wanted. With that card, with the Ontario card, I can walk, I go to my family practice. They assign you have to have a family practice. Mm-hmm. You have to have a quarterback. Mm-hmm. So the first thing you do when you get the card, or even when you get the code number, is phone a
exchange,
and they take your information and say, okay, and then they go look for a family practitioner, and they say very clearly up front, if you don't like them, just call back and we'll get you another. Right. I mean, it's not like we're sticking them, but here's one we think, the one we have right now is a 5-minute walk. Right. They had that criteria, and so my wife and I each have our own family practice,
Right.
and everything goes through them.
Right.
And they can, anything I need in the way of services or diagnostics or testing or anything like that, if it makes medical sense, then he just writes a referral and boom, it's done.
Right.
When I go to get the test, I just show my card.
Right.
They knock it off. There's never a conversation about money.
Right.
There's never a conversation about bureaucracy.
Right.
The only bureaucracy I've encountered in the Canadian system is bureaucracy if it had a specific medical meaning
Right.
and requirement. It was
Exactly. I get exactly what you're talking about. There's a reason for that bureaucracy.
when you're talking about when will I get another appointment, the
Right.
other appointment is, well, when will it make medical sense
Right.
for you to come back? No point coming back in 2 days. Nothing will have changed.
Right.
So to go from the Emory and the Piedmont system, which are very sophisticated systems.
Right.
I mean, those are probably right at the top of U.S. medicine.
Right.
Business practices.
Right.
To Canada, and it's just so clean and simple.
Right.
And because it's all through the same system, my records are available to everybody I go to. I don't have to make.
You don't have to fill out a whole
They
list.
already have them.
Efficiency.
If they've got my code, they've got the access, and they already have my
I tell you something that they use in the United States to dissuade people from doing things like that, right? They like to use this thing called privacy, not realizing, that's in having your records centralized like that is.
Well, you got a trade-off. You got a trade-off.
Right.
You can hide your medical condition from your doctors,
Right.
and you can be confident that they will not know
Right.
what you've had and where you've had it and what's
Right.
happened. And then they can make a mistake and kill you.
And that's what people don't understand. But the other thing that they talk about with privacy is that, well, if everybody has your records, they can actually see it. And to my thing is, the only reason to hide your medical records in the United States system is to sort of con the system so that they don't know, some entity doesn't find out that you had something before.
Yeah, if you're running
pre-existing
running
condition.
a really good Social Security scam,
Right.
then that kind of privacy makes a hell of a lot of sense. I'd be all for it.
Exactly.
I mean, every Social Security scammer. But that's when I say business systems, you got the same business system issues in
Right.
every other business system.
Exactly.
But did the supplier really put stuff in the container before they shipped it, or did it drop
in the ocean? Anyway, Vic, I want to, before we close here, I want to go over that story about your wife.
Okay.
So let's go ahead and talk about something happened recently. Just tell us that sequence.
Yeah, this is after we arrived in Canada, and my wife, my wife went to her family practice,
Right.
and said she was told she really needed to have. It was time to have some diagnosis. There were some signs and stuff like that. Family practice doctor pushed her to go get the diagnostics, and set everything up. It was all done. I mean, boom, 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 boom. She went, got the diagnostics. They found an issue. It was going to require some fairly serious surgery. The next step is the lab that found the surgery. The doctor at the lab that found the surgery had already went straight ahead and made a referral. And where we are, we're very fortunate. There are 5 major research teaching hospitals within a 5-minute drive.
Wow.
So, I mean, they just went around all these great hospitals and said, okay, who's got an opening? Oh, okay, over there. My wife went there. Turns out the doctor is probably top 20, top 50 in North America.
Wow.
Young guy, 40s, sharp as a tack, really nice. And his performance was absolutely professional. I mean, as good as you. Emory and Piedmont would die and go to heaven if they could deliver that service.
Right. And you got some of the best insurance here in the United States, and it turns out that this that's going to cost you nothing.
Well, as I said,
other than your taxes.
Piedmont or Emory on their best day would have equaled what we got.
Imagine that.
She went into hospital. She had surgery. Actually, before that, he wanted to be certain of the diagnosis. So she had full blood workup, ultrasound, MRI, CAT scan, everything. Boom. It took him about 2 weeks to get it all scheduled. He looked at everything, took it to a team in one of the hospitals where they actually review these cases as a group. And, so they get input from multiple eyes on the problem. Came up with a plan, involved surgery, booked her into a hospital. She went in, she had the surgery. She stayed 3 days, went home. She got 10 visits from a home support nurse, RN.
Just a follow-up.
Make sure that follow up after the surgery was going well, there was no infection, yada, yada, yada. And she has regular appointments with a follow-up nurse at the hospital every couple of months now, scheduled out for life. As long as she wants them, as long as she needs them, she can have them. She can just go there. Total cost?
0.
Out of pocket. No, sorry. It's not total cost, a lot more. Out of pocket to us? 0.
But the truth, and then one of the things that I asked you, and we're coming close to the time that we have to close, but one of the things that I asked you was, hey, Vic, but aren't your taxes a hell of a lot more than in the United States? And your answer was a bit surprising.
Well, it's hard to tell, but it's not hugely different. I mean, because first of all, the moment we came to Canada, I was able to drop the Medicare Part B and the Humana Extended Health that I was doing through my pension plan. So right there is about $500 US a month.
A month that you don't pay at all.
That I don't pay at all. Gone. Now, are my taxes higher than that? Because of my situation, it's actually a little high. I had some business losses in a previous year.
Right.
They carry in the States, they don't apply in Canada. So I'll probably know next year. My sense is I'll pay a little more in Canada.
Right.
But
for what it's worth.
But not remotely. It won't be egregious in any way.
Right.
And the net effect is, but the peace of mind. The peace of mind.
And you know that you can get the service when you want the service. So the fallacy that you have to wait. I tell people here in the United States, try to make an appointment with a specialist. Here in the U.S., sometimes you're months away from being able to see a specialist.
You'll be months away from seeing a specialist if it's an elective situation in Canada. I mean,
right.
Specialists for elective surgery are scarce everywhere in the world.
Right.
So you're going to get that, and your mileage may vary. I mean, my mother had a hip replacement, and they made her wait 6 months. 4 or 5 of those months she was doing rehab.
Right.
Now, either that rehab was to
see if she really needed it after all.
Yeah, I mean, was either to sort of a sneaky way of rationing the care,
right,
or it was just damn good medicine.
Exactly.
And I don't know which one it is.
Right,
I'm not going to say.
Right.
Overall, my sense is financially on the medical side, we're going to be close to a wash or somewhere reasonable. And it allows the system that's been built, which has its weaknesses. I mean, there's some areas that Canadians bitch about their healthcare system.
Right. Everybody.
Well, the only thing is when they do survey, if you do a survey of Canadians and say, are you satisfied with healthcare? They'll say no. If you ask them another question, would you trade your healthcare for the U.S.? The answer is hell no. No.
And I think that is where we ended. Vic, thank you so kindly for being part of Politics and Right.
Enjoyed it.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number 1, subscribe to our channel. And number 2, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.